series. There'll be more info on that at the end, but we have Dr. Terri Mathews here to present on the psychological impact of COVID-19 on children. Next slide. So Terri Mathews is an associate professor in the UNMC College of Nursing. Dr. Mathews received her bachelor's degree in nursing from UNMC in Omaha, her master's degree in nursing from the University of Missouri, Kansas City, and her doctoral degree in developmental and child psychology from the University of Kansas. Dr. Mathews' clinical specialty is child and adolescent psychiatric mental health nursing. She is a pediatric nurse practitioner, psychiatric mental health nurse practitioner, and a licensed psychologist. Dr. Mathews joined the faculty at the University of Nebraska Medical Center College of Nursing in 2008. Next slide. All right, and so this webinar is funded by the Pediatric Mental Health Care Access Program. We support the UNMC Telebehavioral Health Consultation Team, and that is funded through the Nebraska grant for the Nebraska Department of Health and Human Services. And so the goal of all of this is to increase access to pediatric mental health care across Nebraska. So we provide guidance and consultation to primary care providers across the state so that they're better able to manage mild to moderate behavioral health concerns in primary care. Part of this is putting on these webinar series. So I will now turn it over to Dr. Terri Mathews.
Well, thank you very much, Christian, and hello and good afternoon to participants. I'm very pleased to present this webinar to you on the psychological impact of COVID-19 in children. As you all know, this pandemic has created immense chaos and upheaval in our society, and so many are wondering, what are the psychological effects on the children in our society? And we are all grateful that children have not been affected physically to the degree that many adults have been, but we know that children are vulnerable to the stressors in their environment and to social distancing. So my goal today is to present a sampling of the literature and inform you of what we know so far. Some of the information will be extracted from experiences of children who have been quarantined from previous epidemics, such as the SARS and H1N1 influenza over the past couple of decades. And so the objectives then are, we're going to be looking at short and long-term effects of COVID-19 on mental and behavioral health of children and families. We're going to identify those population groups who are most at risk for COVID-19 and those likely to experience the adverse behavioral and emotional health outcomes. Then we're going to look at some strategies for assessing the impact of COVID-19 on children, and then discuss the strategies to assist families to cope with and help them deal with the emotional distress that has been caused by the pandemic. So to begin, let's discuss what is the expected response of a typical child who is going through the pandemic. And when we think of the impact on this natural biological disaster that it will have on school age and adolescents, it's important to note it's going to be variable among the youth. It's most likely that most of the children will be resilient and will adapt well. As a matter of fact, a study by Pisano et al. From Italy examined the school-age children ages 4 to 10 years of age, and they found that 92% of the kids were resilient and had low levels of negative outcomes. So what would be a normal response, though, even in those kids who are resilient? So it's expected that most should have a mild degree of anxiety, which would be desirable in an adaptive response. It's adaptive in that most likely those kids are going to be taking more precautions. We would hope that anxiety would help serve as motivation to wash their hands, wear masks, and practice the social distancing. But with the social distancing, it's also expected that kids are going to feel more lonely. Excuse me, they're going to have thoughts of missing out, they'll have reduced contact with their peers, and potentially lack of ability to enjoy some of those previous activities. Many are feeling bored and frustrated and are missing out on some of those important milestones, such as proms and graduations, extracurricular activities. And some of these things really may have affected some of their short-term and longer-term goals. So some symptoms of depression will also be expected. And that might kind of show as withdrawal, anger, irritability, insomnia, some eating disturbances, and feelings of sadness. And so if these symptoms are relatively short-lived, I would say less than 3 months or so, and to a mild degree, and it does not impact their functioning significantly, we would just consider that a typical adjustment. As you know, I would say all people in our country have had to adjust to some degree, and most kids will too. So the degree to which a child is affected will depend not only on the number of stressors, but the intensity of those stressors too. So let's go over there's been a fair amount of research that has been done this year already on what are kids saying, what are the things that are bothering them, what are their fears. And the first of those is the fear of the infection. And a qualitative study of elementary students in Spain, of those kids, they reported that the most significant stressor for them was not only just fear of getting the infection, but if they got the infection and then gave it to their grandparents. They were very concerned about feeling guilty if that had happened. A lot of youth are feeling frustrated and bored, and the frustration was sometimes on missing out on those expected events. Some were frustrated with too much schoolwork or not getting the help and support that they needed from virtual schooling. But most of them just kind of felt bored and didn't have enough to do. A lot of kids reported the stress of not having their own personal space. This was particularly true in those larger families where there wasn't space for the youth to be able to do their homework or participate in school at virtually, and then just everyone is at home all the time. And then the lack of in-person contact was reported to be a significant stressor for a lot of children. Again, just missing out on exposure to grandparents, relatives, and their friends. Family financial loss obviously is a significant stressor, primarily for the parents. But as we know, those kind of stressors trickle down to the youth, especially those parents that lost their jobs, maybe single parents, those with lower educational levels, and families particularly who felt a lack of perceived control were struggling the most. And then infection and death of a loved one was considered the most significant stressor. Some of those children who had to reported fear and sadness and lack of control when watching loved ones suffer, become critically ill, and even those that had passed away. That obviously was the most significant stressor. Okay, and then the stress of lockdown by itself is also considered a pretty significant stressor for most kids. And so what happens to kids when they're on lockdown? A lot of them spent a lot more time on screens, less physical activity, unhealthy eating patterns, poor sleep patterns, irregular sleep patterns, and even for some poor personal hygiene. And some of the kids described the social isolation, particularly the adolescents did, as insufferable. And what they're finding is that there is actually a social craving that they had to be with other people that was similar to the cravings that people get when they're hungry. Some developed addiction to the internet, which led to excessive preoccupations, urges, and inappropriate behaviors, depression, and even some traumatic experiences. So several studies have described the most common behavioral symptoms of distress that had been seen in children associated with the pandemic. And this is not an exhaustive list, but rather the most common symptoms that we're seeing. And so in the toddlers and preschoolers, clinginess was reported the most often, with the rate of about 35% of children in the study by Joe et al. Also, the toddlers had a lot of sleep disturbance, some toileting regression, feeding disturbances, separation anxiety symptoms, and more irritability. Inattentiveness was described as the most common symptom in the school-age children, and that was reported in about 32% of this particular study. But they also showed clinginess, fearfulness, and worry. They were irritable, had more oppositional behaviors, and some withdrawal. And irritability was considered the most common symptom in adolescents at about 30%. They also showed lack of concentration, poor school performance, and an increase in substance use. And anxiety symptoms are probably the most common complaints that the primary care provider is going to encounter in children struggling with the effects of the pandemic. And these will likely present as somatic complaints. Most commonly, you might see headache and fatigue, maybe dizziness or fainting and memory problems. Of course, you'll see a lot of the GI complaints such as stomach aches, nausea, diarrhea, maybe even vomiting. And then in more serious type of symptoms, you might see some panic disorder, symptoms even of shortness of breath, trouble breathing, chest pain. And then again, people who might kind of fear that they have the pandemic, you know, the chest pain and trouble breathing may seem to them like symptoms of COVID. And then in more severe situations, you might even see some sensory changes such as vision or hearing changes. This might actually be a conversion reaction that needs definitely more a referral to psychiatric services. As you may expect, the high-risk groups most likely to be negatively impacted are those with lower socioeconomic status and the minority population. As we all know, the minority populations have been impacted much more significantly than non-minorities. So again, they were exposed to higher rates of the pandemic, of the infection, of course. But they also found that younger age children and females tended to show more negative outcomes compared to males and the older age group too, which I thought was quite interesting. So children with physical and developmental disabilities are certainly at high risk. An interview of Hispanic parents of children with DD reported an increase in behavior problems, boredom, and lack of structure in those kiddos. And they also noted that their progress in developing developmental skills was slower, and they were noticing regression. And children with pre-existing mental illness are certainly considered at high risk. And in a survey of over 2,000 adolescents with mental health history in England, 83% of them reported their mental health was worse, and about 25% said they were no longer able to access the mental health support since the pandemic. And for those that had an underlying depression, they reported experiencing more social isolation. And those with ADHD had more difficulty with adjusting to lockdown and demonstrated more behavioral problems. Of course, those children with autism spectrum disorders really struggled with the change in routine and the lack of structure that was present in many homes compared to their schooling. Adolescents with eating disorders were immunodeficient related to chronic malnutrition, were also more susceptible to infections. So then when you look at parents, first of all, parents of children with disabilities really reported a significant problem with parental burnout and having less social support than parents who did not have a child with a disability. Particularly, again, those parents of children with autism, not only were they now in the parenting role, but many of them had to be a special ed teacher. They were trying to kind of carry on with what speech and language pathologists may have done or had been working on with their child, or behavioral therapists, and trying to help out with occupational and physical therapy type services. So it's really, really a heavy burden on those parents with autism. And then two, parents who have existing mental illness, such as depression and anxiety, many of those had lost jobs and were certainly experiencing additional distress. And what they found is that those parents who had higher risk of job loss showed poor coping skills. There was harsher parenting, and again, led to greater risk of child abuse and neglect. and children, of course, who already had a previous history of child maltreatment tended to be more at risk than previously. So if you can kind of focus on these high risk groups, I don't think this is a surprise to anyone, but those are really the ones that have particularly been affected. So as you may expect, the most common psychological outcomes associated with all these stressors and in these high risk groups are anxiety, depression, PTSD, higher rates of domestic violence, child abuse, and an increase in substance use. So we'll talk a little bit more about this. Cho et al. Reported in a study of over 8,000 adolescents, the prevalence of anxiety was 37%. So that's really quite high. Normally, we see anxiety probably ranges from like 15 to 20% in most adolescents. Depression is somewhere between about 8 to 12%, but depression in this group was 43%. And those that had a combination of both anxiety and depression was about 31%. PTSD was reported in about 5 to 7% in a study by Liu. And Sprand and Silman also found that the PTSD scores were 4 times higher in those that were quarantined versus those that were not. Again, risk of domestic violence, child abuse, and neglect were reported to be 5 times higher in rate. However, there are other studies that have showed that the reporting rates really have been lower in some areas. And this was attributed to that since kids aren't in school and oftentimes school personnel are mandatory reporters, there were actually less reports occurring, but it was actually still happening in those homes. Now, I did not find any specific data on the prevalence of substance use and suicide in our adolescents, but in a report from the MMWR in August of 2020, they showed in the 18 to 24-year age group that substance use had either started for the first time or increased in 24.9% of that age group. And those that had, and 25.5% had seriously considered suicide. So these are all considerably higher rates than what we normally see. So certainly there is a significant impact. And obviously we are still in the midst of this pandemic, so the long-term impact really is not known for the COVID-19, but we do have some data from other studies that have shown the impact of quarantine and, through the SARS and the H1N1 influenza epidemic in the past couple of decades. So a study by Varikos, who looked at the economic impact of the influenza epidemic, showed that with those individuals who had lost jobs, with business closings, increase in sick days, a decrease in revenue generated, and medical costs, the hardship that had developed from all those economic influences led to a lot of family conflict, domestic violence, child abuse, suicidality, and substance use. Also, mental health services were diminished. Now, I don't know if most of you remember back in 2010, it really did not seem to affect our country that seriously, but there was quite a bit of impact then. I mean, we just have to imagine this is a much, much bigger, broader pandemic. And so we know that in the future, we likely are going to be struggling with a lot of these same effects and probably to a much greater degree. And then there's a fair amount of data on the effects of quarantine, long-term, and mental health outcomes. And the study by Wu et al. Showed that 3 years after quarantining, the rate of alcohol use was still significantly increased. And Reynolds et al. Found that after with quarantining, 20% of those individuals avoided public spaces long after the quarantine was over. And many of them had feelings of guilt, nervousness, sadness, and fear, and excessive hand washing. And that was, again, several years after the quarantine. And then now we're already seeing a study that is showing some of the missed opportunities for development for those children with developmental disabilities. And we already know in our society, kids with autism and other developmental disabilities have a hard time accessing services in a timely manner. Well, with the pandemic, that wait has even been much longer, and children are really missing out on getting some of the services that they need. We just have to speculate that, their outcomes developmentally will probably be less than optimal because of the pandemic. So I really didn't find any specific guidelines on how you assess for kids going through the pandemic. So I'm just kind of going off what I do and what I think makes sense. And so these are some of the topic areas that I talk to each of my patients about. And I primarily see children with behavioral and developmental problems. A lot of my kids are on the autism spectrum that I see. And so I'm just going to kind of go with you some of a rundown of the questions that I ask the families. So first of all, I always ask about COVID. Have you been exposed or have you had the infection? What about family members? How are they doing? Has anyone passed away? And what infection control measures are you taking? Are you wearing a mask? Are you practicing physical distancing? Are you washing your hands? So I kind of go through the whole kind of spiel about any exposure in their experience with COVID. And then I always ask about school. To how are you in person or virtual? How's it working for you? Do you have support systems from school? Are you getting your special ed services? Do you have tech support? A lot of parents, just maybe don't even feel comfortable with helping kids with some of the technology, and who is helping them with getting that support system that they need? How are their grades? I actually have a couple patients right now I have one who did not get any credit last semester. I feel bad about this. We tried to do a lot to get him into help and therapy and go to school. He just refused and got 0 credit last semester and is not on a good path to get any credits this semester either. So a lot of challenges. And then we asked too about relationships. How are you getting along with your siblings and your parents? Obviously families are in close proximity and are not seeing a lot of others, so they get on each other's nerves. And if they do have access to seeing peers or friends, how are they doing that? Is it through virtual platform, Zoom or FaceTime, or do they get a chance to be out in social like sports and different activities with their kids? And I really do think it is important, and we'll talk about assuring the kids find ways to communicate and interact with their peers because it is so important for their social development. And then I try and ask most families about social determinants. Do they have adequate food? Do they have access to healthcare, housing, transportation, and even question if they might need a social worker? And some people might feel a little uneasy asking some of these questions, but, just yesterday I asked a family, do you have enough food? And, how are things going? And it's not a family I thought was actually struggling much, but she said, oh, thank you so much for asking that. And she said, actually, I did lose my job. I am going to get another one, though. She said she had another job lined up, but you just never know how, many parents or families are afraid to or embarrassed to tell you that they might be struggling in that way economically. But, we really, if kids aren't eating well, or, there's so much stress about those economic difficulties, we really need to try and do what we can to help. So if you have access to a social worker that you could kind of help them with finding resources or pointing out where food pantries might be, that can be so helpful to them. And then recreation and hobbies. I try and ask the kids, well, what are you doing to stay busy? How do you stay from getting bored? And, are you working on any new projects or artwork, or how are you getting your exercise? Just, kind of talk with them about finding ways to keep themselves more occupied to reduce some of that boredom. And then silver linings. Now, if, they've told me there's like 10 things that are absolutely going wrong in their life, I don't necessarily always bring up silver linings because it seems disrespectful, like, okay, so what are the good things happening? So, but for those average Joes, like, maybe you and me, we're getting along and, nothing serious has really happened, to help kind of lift those feelings of depression and to make, put things in perspective. What are the positive things that you've noted that have come out of this pandemic? And a lot of times I do hear that some of the kids especially are happy that they've had more family time, that, maybe they like the quieter pace, the slower pace, and maybe a little less stressful lifestyle if they're not going out and doing things all the time. So, but really my intention is to help them find ways that they can recognize that they've been able to get through this pandemic without significant negative outcomes. And so once you have asked these previous questions, you likely will have a feel for how well things are going for the youth. And you will likely be able to, suspect if there's some anxiety or depression or even PTSD symptoms kind of occurring. So, but aside from asking those specific questions, for depression and anxiety, you might want to use some rating scales. And I think these would be very, very helpful. Most all of you probably are using already a depression scale, either the PHQ-2 or the 9. And here is a link for the adolescent version for the PHQ-9. So you can download that and use that in your practice. The screen for child anxiety related disorders, or the SCARED, is a really good tool too, just to assess for anxiety. And this is a new tool that was just developed out of UCLA. It's a PTSD COVID screening tool, and you can download this as well. It kind of looks specifically for some of those stressors and trauma that have been related to COVID-19. And then finally, if you have concerns about suicidality, the Columbia Suicide Severity Rating Scale is a good one to use as well. And this is the link for that as well. So those are all free and downloadable tools. So I know you all have busy primary care practices, and you probably are thinking, well, how do we have time to screen for all the kids with these various tools? But you might want to consider, who are those most at need, and who are those high-risk groups that we talked about previously. And maybe if you can kind of solicit help from some of your staff support, and you might recognize, I know a lot of you probably know your families and have a pretty good idea who might be at risk. Think about, when they're waiting in the waiting room, about filling out these tools. And I don't know if some of you are doing telehealth visits, but you can even, just read off the questions to the child or the youth or the parents too, just to see if they are, if they meet those criteria. You can do that verbally over the phone by telehealth, or use the paper and pencil tools too, maybe electronically. So I just want to make sure that the primary care providers are aware of the Nebraska Partnership for Mental Health Care Access and Pediatric Screening and Referral Guide. This handy resource was just developed last year by the Nebraska Department of Health and Human Services to assist primary care providers with access to screening tools. So some of these screening tools that I just mentioned are in this pamphlet too. But it also provides resources for behavioral health providers that may be a good referral source for you. So if you're not familiar with this guide, please take time to review it for future reference. And again, there's a link here, and I'm not going to take the time to go through each of these. I'm pretty certain that you're going to be receiving these handouts so that you can go to these links. So as a primary care provider for children who are showing impairment, you likely will be diagnosing them with an adjustment disorder. And there are several specifiers that may be tied to the adjustment disorder diagnosis, such as depressed mood, anxiety, or your mixed anxiety and depression, and then disturbance of conduct. And that's typically for those children who are showing more disruptive behaviors, like maybe more physical aggression, verbal aggression, destruction of property, or maybe lying, or vengefulness. So those kinds of behaviors would be the disturbance of conduct, or they could have a mix of the disturbance of emotions and conduct. So you might see some of the depression mixed with the conduct behaviors, or it could be unspecified if it really doesn't meet criteria for one of the previous. And for those youth that might have already a pre-existing anxiety disorder, such as generalized anxiety disorder or depression, when you look at maybe if they have an exacerbation because of the COVID pandemic, you would still diagnose them with anxiety and depression and then add an exacerbation. So if you're concerned about symptoms of PTSD, you know, if you want to look through the criteria, it's not always so easy to maybe put that diagnosis together, and you may want to refer. But if your tool is showing positive for screening that I showed earlier, and they're showing symptoms from the categories of that they've had exposure to someone who's either actually died or even hearing about a very close relative who has died. And then they would likely also have like intrusive thoughts or dreams. There may be avoiding or distressing thoughts. There may be a significant change in mood and cognition, or change in their arousal and reactivity, such as hyperarousal, irritability. They may be meeting criteria for PTSD. And if those symptoms have been occurring for greater than 30 days, we do describe it as PTSD, but if it's less than 30 days, it's more diagnosed as acute stress disorder. So Bond described this model for a role for child mental health professionals that I found in one of the articles, but I believe that this is a model that all of us really need to consider as child health professionals, and especially considering the overwhelming nature of this biological disaster. We all need to be involved in finding ways to help children and families cope, and to find ways to build resiliency during the pandemic. And of course, as a primary care provider, I know that physical needs are priority, but additionally, I see the PCP role involves preventing some behavioral health problems, such as working through fears. We can certainly have a lot that we can do with misinformation control. And once again, finding ways to help that child strengthen their resiliency so that they might be able to see some post-disaster growth. So that kind of is our goal, is that we want them to see that they can succeed and challenge to get through this difficult situation. And so one of our first interventions is to help reduce the fears. And this will include reducing anxiety through providing information, guiding youth and family on safety skills, infection control, and development of the coping skills. So while having a healthy sense of fear is adaptive, it's important to help the child and family to recognize irrational behaviors. And we know there have been quite a few irrational behaviors at the onset of this pandemic. But on the flip side, we also want to recognize that some individuals, and not uncommonly adolescents in our society, have believed that nothing bad is going to happen to them. So we tried, it's kind of a balance to figure out how do we instill a healthy amount of anxiety and fear so they follow those safety guidelines while at the same time not being overwhelmed with the stress. And so with those youth that might feel kind of omnipotent, that nothing bad is going to happen, they might need more closer monitoring to encourage encourage them to kind of follow the infection control guidelines, and to deliver consequences as needed to ensure the guidelines are followed. Vaccine safety has been another fear, and although we know it's not yet approved for children, we want to encourage our families to get the vaccine when their turn is up. The most recent report from the American Academy of Pediatrics and the Advisory Council of Immunization Practices indicate that the Pfizer vaccine can be given to adolescents 16 years of age and older, and the Moderna vaccine is approved for 18 and older. And studies currently are still being done for those 12 years of age and older. And then we want to provide reassurance as we see appropriate with school attendance. Now, I know that school districts, the school districts that are open, I mean, it's real variable across our state and country, and it's based upon transmission rates. But the CDC's latest information shows that when all the mitigation efforts are followed, schools are really safe to be open. But of course, not all schools have the resources to follow those mitigation efforts. So again, we really don't have a blanket statement for schools yet. But if your school district has deemed it safe, we want to provide reassurance to those families that, it is the right thing to do, that kids do need to be in school, but we have to really understand the community transmission in that area. And as we know, there is a lot of misinformation circulating in our society. And in order to help our families, we have to ensure we are up to date on guidelines and ensure we offer that information to families. It's important that we refer to our professional organizations, the CDC, public health departments, to ensure we give accurate information, help debunk some of the myths and controversies. And it's just kind of amazing to me. Yet just last week, I heard on one of the cable television channels, they were reporting on a woman who was speaking out to a large group of people saying that she would not get the vaccine, nor would she allow her children to get the vaccine because vaccines are the #1 cause of autism. So still a lot of misinformation is out there. So it is our job to assure that families understand the accurate information. And I just want, people to think about our kids. Now, children, in order for them to feel safe and secure, they need to be able to trust adults. So we have to think about what that is doing if they hear maybe their parent giving them information, a teacher or healthcare provider or state leaders maybe giving different information. What does that do to their sense of trust and sense of security about feeling safe during this time? So, and I know this is not easy, but if you have a family who is refuting something that you're saying or, trying to give information to the child in front of you that is inaccurate, I would suggest you ask to speak to the parent alone and really talk with them about what it is that we know is accurate data. Obviously, you have to use a lot of empathetic listening skills and making sure that we validate that there is misinformation out there, and they may be doing the best that they know how to do, but it really is our job to ensure that we educate and deliver the most accurate information as possible. And it's just what we have to do for the kids because they're going to hear different information, and that's just not going to be good for their trust level. So remember, our goal is to help children learn and grow through this pandemic. So what are some of the things that we can do? And we'll be talking about that in the next few slides. But a point I want to make is, there's so many people who are struggling. And if you have families who have some more resources, we want to see how we can help children maybe help others. We want them to be part of the solution, not part of the problem. And some of those strategies might be considering, maybe seeing if the families or children could help out with food pantries. We want to make sure they're not bullying other kids, whether wearing masks or not wearing masks. We don't want them to be bullied either. And how do they deal with that bullying? What new activities or skills could they learn? Maybe it's art, maybe it's music, with that boredom, what can we do with our time to help us develop as individuals? And so that, I think, is kind of the fun stuff of what we can do in this pandemic, is helping kids figure out how to deal with how they can kind of build their self-esteem and show areas of skill acquisition. Now, the American Academy of Pediatrics has a really nice guidance, interim guidance on supporting emotional and behavioral needs of children and adolescents. So there is, I have If you just Google this, you will be able to find it. But I think it's a really nice kind of a roadmap how to help families. And they have specific guidelines addressed for each age group. So with the preschoolers and toddlers, they recommend that parents provide more structure and routine with the little ones, more one-on-one attention. So usually I recommend parents spend at least 15 minutes of one-on-one time with their toddlers and preschoolers. So that might even need to be increased to about 30 minutes each evening. We know that when children are under duress, they need more presence, physical presence from their parents and families. So just thinking about spending that one-on-one time reading books, modeling good coping skills is so important for the parent. And remember to catch them being good. Give as much positive reinforcement as possible. And for every time we have to give some negative feedback, we want to give at least 3 to 5 positives. For the school age group, the most important guidance is lots of structure and routine. And so I would even recommend, and I've done this for some families, recommend a visual schedule to have at home for their school age kids. This is what you do from 9 to 10, 10 to 11. You know, you can throw in some unstructured playtime and free time, but kids need that guidance as to what to do and how to structure their day. You can increase family game time, allow expression through art. Ensuring you are talking with the kids too, or for parents, of course, is to communicate with them about what's going on in a developmentally appropriate way that they can understand. We want to also monitor and limit some of the screen time and news media, especially if a child is becoming frightened by some of the media that they see. We want to make sure that that's limited, and maybe some of that discussion would come through the parent rather than necessarily the television. Encourage family exercise and walks. As much as possible, giving opportunities or encouraging kids to get out and play outside will certainly benefit their mental health. And for adolescents, support and model structure and routine. Again, we want to have parents to model good coping strategies. And we do want to encourage social connections versus Zoom or FaceTime. And we want to provide empathy for those adolescents who may be really losing out or missing out on some of those celebrations and, you know, social activities that normally would have occurred during those high school years. And although we do want to set limits and deliver consequences that are a significant breach of some of the physical distancing, we don't want to be too punitive with that, because, you know, there's going to be kind of a balance as a parent to assure that the adolescents get that social time, but you just don't want to be too punitive with them, but still encourage them to have that healthy sense of caution. So now I'm just going to address additionally some coping strategies that you might suggest for parents. Over and over, I've read, you know, parents who model good coping strategies, that's going to trickle down to the kids. And if the parents are calm and relaxed, their kids will be as well. So if you have time, I think it'd be a great idea to approach families who appear to be struggling with just what are some good coping strategies. And you can really suggest these to the youth as well as the parents, but some of those might be just assuring that they're setting realistic expectations. We've all had to adjust what we expect to be occurring in our lives over the past year. And for the parent too, I mean, if you've got, you know, real perfectionistic parents, maybe their house isn't clean all the time because they have so many responsibilities now with helping their kids with schoolwork and everyone at home and cooking and just all the things that you probably hadn't been expecting to do. So what's realistic to get done now compared to previously? Recognize what you can control and what you can't. You know, school being in or out, you can't really control that as a parent. So you want to make sure that you kind of go with the flow for what you can't change. And setting goals for each day. That's just a quick idea that you can give parents each day, maybe 2 or 3 things that you want to get done. It may help you feel, may help them feel less overwhelmed. And it doesn't have to be huge goals, just a few simple things, but it gives them a sense of accomplishment. Problem-solving strategies are important too. So if a family has a significant problem, usually you can help them identify 2 or 3 solutions to that problem, and then look at what are the negative and the positive consequences that come out of each of those solutions, and that will help guide them to maybe making the best decisions. And once again, we want to encourage gratefulness and finding silver linings. For people who are feeling kind of down and depressed, when you identify things that you can be grateful for, it's kind of looking at that glass half full instead of half empty. And that can kind of help lift some of those depressive symptoms of thinking that, you know, life is just terrible right now. And then any of these relaxation strategies can also be very helpful in reducing anxiety and tension. Some individuals may respond better to some than others, but the key is to ensure the youth or parent is comfortable with the strategy, and then it needs to be done regularly and with practice to get the most benefit. So when a stressful situation arises, the individual can access these strategies and it will help them with relax. So breathing exercises are an easy strategy to use. Most all of you probably know the deep breathing, taking deep breaths in through the abdomen and then very slowly releasing those breaths out. There's a lot of online yoga classes that people might want to consider getting involved in, and that certainly provides a lot of relaxation for people. I find teenagers really do well with just listening to music, just get their headphones, and parents certainly too. That's a good strategy, but it's very simple enough to do if they take 15 minutes to half hour at nighttime before bed with some calming or music that they like. Progressive muscle relaxation is another good strategy that generally that involves taking 2 or 3 muscle groups and contracting those muscle groups tightly for about 5 seconds, and then relaxing slowly over 7 to 10 seconds. And you can just feel your muscles relax as you're doing it. And then meditation. Meditation is very helpful, especially in the evening hours, to just take that time for yourself to focus on your breathing and your inner thoughts. And there's a lot of good apps out there that you can encourage families to download. A lot of them are free. Some that have been shown to have good, there's scales where they can rate the apps for effectiveness and credibility, I should say. To be honest, most of the apps do not have a lot of research tied with them. Only about 3 to 5% of apps actually have any research to support their effectiveness. But there's through the American Psychological Association and APA, or American Psychiatric too, they have experts who rate some of these apps. And some that have good ratings for kids are the Breathe, Think, and Do with Sesame, or Smiling Minds. Calm is another good one for both children and adolescents. So those might be good tools that you can easily suggest to families to kind of help themselves. Okay. Again, you all know the benefits of exercise, healthy diet, and adequate sleep. Can't overemphasize that enough, that these 3 things are so important for mental health. Getting at least 30 to 60 minutes of physical exercise, and you can do that outdoors fairly easily without having to wear masks, and yet maintain your social distancing. The healthy diet, high vitamin D can help improve the immune function, and then making sure those kids are getting adequate sleep. I haven't talked much about sleep, but we've seen a lot of youth that have been staying up late and then sleeping late into the morning, early afternoon. This certainly is not great for mental health at all. We still think it's best for them to be on a schedule that is very consistent, sleeping at nighttime. Adolescents need about 9 hours, and school-age children about 10 hours of sleep at night. And then assuring the child has social support is really another very important strategy to strengthen resiliency. And actually, the most important protective factor to support resiliency is for a child to have at least one caring adult in their families. And when families are in duress, we need to remind them of their role and how important it is for their child to have that caring adult available. And if the parent isn't there, then maybe it can be a grandparent or an aunt or an uncle or a coach or a mentor or a teacher. But having adequate support is so important. So we do want to encourage them to have some access to peers and friends, but also adults who are maybe even a mentor might be a support person for them. And in our estate, we have quite a few mentoring programs through Teammates, Boys and Girls Club, Big Brothers and Sisters, and NAMI is National Association of Mental Illness, has a family support system that may be helpful too for families. And then when you have a patient who is struggling, it is very important to consider what referral resources are available. We know with in a busy primary care practice, you won't be able to do this alone. So, hopefully many clinics now and primary care clinics have mental health providers in your clinics. I would suggest that would be your first referral source. Potentially, if you have social workers or case managers to help with finding some additional resources, that's probably needed as well. And here's a link for resources available for teens. This is primarily for those struggling with substance use. And then, it's always important to remember we have our behavioral health regions here in Nebraska. And there are, these are resources that can particularly help those families that struggle in the lower socioeconomic groups. And they do a lot of in-home therapy and will come into the homes and help families and youth who are struggling. And so just so you remember, we have Region 1 group is in the Panhandle, 2 kind of in the Southwest, 3 in the Central, 4 North East, and then 5 is the Southeast with Lincoln, and Region 6 is primarily the Omaha Council Bluffs, or the Omaha Sarpy County areas. The Cass, it looks like, is involved too. So I'm going to go back to this slide so you kind of see this link right here gives names and addresses of the people to contact in each of those behavioral health regions. And here's some hotline numbers too that you can contact for if people are struggling with either suicide, abuse and neglect, economic assistance. Catholic Charities has a lot of good resources too for families with substance use. Here's just a couple more resources you can look at as well. And I just want to leave you with a couple of takeaways. First of all, we do have an impact on how children will adapt and respond to this crisis and disaster. And just recognize children are watching us and learning from us. And as healthcare providers, our role is to educate, role model, and assure children have the tools for knowledge, security, and safety. So we educate our kids and we educate the families. All right, thank you. And I think we just have a few minutes, but we have a few more slides to go through, and then should have a couple more minutes for questions. So I'll let Christian take over with them. Any comments?
Any questions, you can use the chat box at the very bottom of your screen.
I have a comment. I know I always appreciate having apps that people can download, especially free apps. I know there was one app that I really liked that I used for mood monitoring that now it's not free anymore. So I love having plenty of free apps that we can give people.
Thanks, Christian.
Well, we'll give like another minute or so if anybody does have questions. Otherwise, we really appreciate you all being here today. Please make sure to fill out those evaluations, and we hope to see you over the next couple of months.